Здравствуйте, уважаемые коллеги. Мы сейчас выйдем в эфир с Идо Адари во второй части про израильский опыт. Ребят, выведите, пожалуйста, Ида на экран. Ага, вот он, я его вижу. Прекрасно. Я продолжу сейчас все на английском, и переводчик наш будет переводить, как и в прошлый раз. Линк на английском будет тоже потом доступен. Ищите потом линк на английском на нашем канале. Тем, кто не смотрел первую часть на английском и хотел бы ее смотреть без перевода, такой линк уже доступен. Поэтому поехали. Идо, hi.
Hello, how are you?
You actually look like an Israeli person when the snow hits Jerusalem. Is it true that you have snow in Jerusalem?
Ізраїльтянин, коли розпочався сніг в Ізраїлі, в Єрусалимі. У вас дійсно є
On our part 2 and discuss a couple of issues which we did not discuss in part 1. I prepared some questions. So my first question is the following. What is the overall strategy? How many people and in which terms Israel want to cover, and what will it change in the life of the country overall? What are the expectations?
We have in Israel about 9.5 million persons, but only 6.5 can get the vaccination because 3 million are kids below the age of 16. So even if all the adults will get vaccinated, we will have only around 67-70% of coverage, which is too little to achieve herd immunization. So first of all, we must achieve the highest possible number of these adults to get vaccinated. So we will get closer as possible to the 70% coverage, especially with the highest risk groups like aged 50 and more, people with chronic conditions and other illnesses. Also, we are targeting and focusing on medical staff members for sure, and on education staff members like teachers. So,
and in which terms do you plan to cover this 6.5? Through how many months you want it to be done, basically? What is the idea for the moment?
Well, it's you have to deal with it like a braid of hair, like when you are doing for the girls, you are doing with the hair. You have three things that you need to focus on. First is the supply. Second is the logistics. And third is the demand or the public behavior. So in terms of supply and logistics, we are able to vaccinate all of them within a few weeks from now. We already vaccinated over 60% of this target population.
Over 60% of the highest risk group?
No, with the highest risk group, we are nearly 90%.
Oh, okay. So yes. 60% of this overall 6.5 million, right?
Yes.
Okay.
And it seems to be that the level of demand is keeping very steady state, but we want it to be steady a bit higher than it is now. Mm-hmm. So we are able.
How do you measure the demand?
Well, we know how many people are scheduling appointments each day, and we know how many people are arriving to the vaccination compounds each day. And we are able to vaccinate much more than we do now. The logistic can support about 250,000 people per day, 250,000 per day. And now we see about half of it only.
But you are able to do 250,000 vaccinations per day, correct?
Yes.
Through how many sites? Through how many vaccination sites?
all the 4 health funds can do it. We have around 400 sites.
Mm-hmm. So coming back to my previous question, how long you think it will take to cover the target which you initially had? Couple more months?
Well, I think it's not going to be linear. It's going to be once we get out with a green passport, which will allow someone who got vaccinated to enter theaters and football games and to go to restaurants. I'm sure that we will have a rise in a demand, because most of the people who did not get vaccinated yet are 20 to 35. And this is exactly the ages that will want to use this green passport privilege and would like to get vaccinated for that.
Ido, and how this green passport will look like, whether it will be an app on the phone, how it will be checked in the restaurant or in the football stadium or where?
So there are going to be few layers of verification. First of all, once I got vaccinated with the 2 vaccinations and a week after the 2nd vaccination, I get to my cell phone, I get a card that says that I am a vaccinated person. But since it's very easy to make a fraud and to prepare myself one, I understand that many TikTok groups are doing it already and Instagram groups. What is going to be done is many of the places like theaters and everything, you will need to book your tickets in advance and to provide your ID number. And just then you will be checked if it's correct or not, and you will be identified again once you reach the theater.
And if it is a restaurant?
I don't know how it's going to be done, probably with someone at the entrance that need to check your card, like with a barcode.
Do people discuss that it somehow violates the freedom and the privacy?
Yes, there is a legal debate, and that's why the government, like always, the government taking her time. The legal departments are doing hard time to the health ministry, and they are not allowing too much robust green passport. There was even a discussion here whether someone who got vaccinated maybe can get some money from the government as a gift to promote the vaccinations. But then the legal department said that this money will be taken from all the citizens. So it comes also from money of people who does not want to get vaccinated. So there is an issue, but I think that as we can see, most of the public is very reasonable and the percentage of vaccination is very high. So I'm sure that the boost that will be created by even a medium-sized green passport will make a difference.
Tell me again, when do you think, at which figure of coverage, the restaurants and some other activities will be open again?
They are open again starting this Sunday, 3 days from now. The government decided to take back the lockdown, and also kids at primary school are going back to schools. So the economics is running again, not all the economics. Restaurants, there are going to be some restrictions, but maybe halfway it will be opened. And if they will see that there is not too much of a problem, maybe they will reopen the restaurants, let's say 2 weeks from now.
And when Israel will be ready to take back the tourists, because we know that a lot of Israeli economy is as well tourism, as far as I can imagine.
Yeah. First of all, Katya, if you want to come to Israel, I can arrange something. But I really hope that there will be some arrangements for tourists to come. They are opening we have just one international airport in Israel, and it's going to be opened next week with restrictions, of course, but I hope it will be, it will allow tourists to come. Yeah, for sure.
Coming back to the goals and the groups. So you already covered, as you said, around 70% of the whole target, right?
Nearly 70%, yeah.
So who is giving you hard times out of the 30% left? And what is the difficulty with the messaging or with some other approach for this other group? Who are these people and what is your approach of working with them?
Well, first of all, we can see the diversity with ages. Once you reach 50 years of age and above, the level of acceptance is very high. This is not a problem. And also, on the other side, 16 to 18, it's a very high ratio. And very surprisingly, I must say. The challenge is 20 to 35, this age where you, like 20 to 30, you are not even a parent yet. You don't feel responsible for anything. You work very hard, etc. And you feel very young and healthy. So this is going to be a major challenge, but still, I'm sure that this is the right target audience to speak with the green passport. They will get.
So you don't believe in their goodwill and you just only want to push them?
No, I'm saying that half of them already got vaccinated because they understood that it is important. The other 40%, because we are not aiming at 100%, the other 40% will get a boost once the green passport is in. Plus, I must say that more and more employers are saying to the workers, don't come to work and I will not pay you unless you get vaccinated. Now, maybe the worker will sue his employer, but I'm sure no worker wants to sue his employer. So even if it's not that legal, still, I'm sure that many employers are going to be very stubborn on that.
And which narrative is used for these people? Get vaccinated to save others from the risk groups, or which narrative is being used?
That's a very good question. You have to use few narratives together. It's like when you make a soup in your kitchen, you don't use just one herb. You use salt and you use paprika and you use many other things. So we have to use many herbs. First of all, yes, some kind of recruiting by creating some fear. Look, this guy in your age just died and left a baby 2 weeks after she was born. This is a very hot story now in Israel. So a bit of make people afraid. Second is make people responsible. Well, yes, you are young, you are healthy, but just think how you will feel if you will make your parents sick. So in order to avoid this feeling, you must get vaccinated. Third, it's the local shops. I initiated a campaign, which will start very soon. We took the very local hairdressers and cosmetic small shops, and we asked the owners to be the presenters, to say, look, I really want to meet you again. You are my clients in this neighborhood. In order for me to get back to work and to bring some money home, but mainly to make your hair look better, please get vaccinated. So it is delivering the messaging in a locally way, not from above, but from someone you know from your street.
And how did you do it? Do they produce videos where they say it to people and put it on networks, or how these local people are doing it?
Yes, some of this will be done by social networks and by short videos, and some will be done with like signs on the streets in the specific neighborhood.
Tell me, you have what, 4 or 5 HMOs in Israel now, right?
4.
How did you guys coordinate between each other what you will be doing with the immunization? Or was it only one regulation, one policy for all 4 of you and your clients?
The policy was dictated by the Ministry of Health. He did a consultation. He does a consultation two times a day with us, with all the 4 HMOs, some of the hospitals, the Ministry of Health, the Ministry of Finance, the legal ministry as well. And we are together with the ministry deciding on a policy. The execution of the policy, my HMO, we were very by the book. Other HMOs had some kind of very wide sidewalks or very wide borders, not very strict borders with their policy. Like when the ministry said, vaccinate only people 60 and above. We did that. Other HMOs went to much lower ages, much more attractive ages. But it's okay. We managed.
But in general, all of you were using only external vaccination sites, which were not situated in the hospitals, right?
No, in the hospitals, it was a very short, like few days it was done in the hospitals, and the government understood it's wrong. Maybe you asked if we did it in our clinics. Most of the HMOs are acting this vaccination outside in compounds that are separated from the clinics. Most of the clinics.
So the overall logistic is pretty much the same with the different HMOs, right?
Yes.
So the only difference would be the by the book according to the target audience, and that's it, correct?
Yes, and also with the scheduling of the appointment. Some of the HMOs said, look, just schedule yourself the first appointment. Let's make that as first step. Then when he reaches the vaccination compound and makes the vaccination, then they scheduled the second appointment. We decided that it would be better to give you the first appointment and at the same time, automatically tell you what will be the second date, the second appointment, 21 days later.
And how the whole operation is managed, because it's a huge logistics operation, pretty complicated. So how is it managed? Is there one person like commander-in-chief who is managing the whole vaccination in Israel, or is there a group of people, and how they operate? How big is this group? If it is not a secret information, of course.
The policy of vaccination is managed by a committee that we are part of, and it's very wise to take the field agents and to make them part of the policy makers. And once the policy is set, the HMOs are doing the execution. We are told that we are going to have 200,000 vaccinations for next week, and this is the target populations now. Now it's open for everyone, but once we had only with target populations.
How easy it is to manage the whole operation, and how do you get the feedback on what works and what doesn't?
It's not easy. It takes a lot of time from thousands of people, and what we do is Maccabi is divided, my HMO is divided into 5 regions. And each region, of course, there is the national Maccabi's policy, but I'll just give you one example. One region decided to do a drive-in for vaccinations, as I showed in one of the videos. But just one region decided to do that. So we are very much flexible, providing the head of the region to decide how will he do the vaccination. There is a very strict protocol, but he can still make a lot of decisions according to his population or to his geography limitations, etc.
Were there any general contraindications which you would be announcing to the public that in this and that case, this is a contraindication to vaccination?
Yes, for sure. First of all, when you want to schedule the appointment, you have a short questionnaire that you need to fill. And then when you come to the vaccination, the nurse will ask you a few questions again. Now, people that are suffering from very severe allergy cases like anaphylactic shocks and everything, they are tend to consult their doctor. And there is a special phone number for primary doctors that they can consult with experts in allergy on each case if they want.
Was it the only contraindication, correct?
That's the main contraindication. And it's not that common, of course.
Was it, and basically you prepare the special group of allergy specialists who are picking up those phone calls. Yes. Mm-hmm. And what is the policy to those people who, for example, between the first dose and second dose got COVID?
Yes. In this case, we will not vaccinate them with the second vaccination because they are considered... Sorry?
Until what time?
Well, there is a discussion on that already, not just about them, but about everyone who got COVID, even if he didn't get the first vaccine. So once there will be a decision upon them, we are ready to vaccinate them, of course. We don't have a bottleneck of logistics or supplies. Now we just need to lift more the demand.
Mm-hmm. What was the most difficult thing for you as for the communication and the public relations specialist during COVID in general as the outbreak and during the vaccination campaign, because those are two separate periods. One was the COVID when the vaccine was not available, and then the COVID when vaccine is available. So what was your big challenges during this periods?
I think that the public understood that this is a new thing, but still he had expectations that we will have answers for everything. So at the first few days, there were a lot of problems with the PCR tests. And it took a few days until you got the result. So you waited isolated at home without any result. The public was tolerant in the first, let's say, few weeks, but then the toleration ended and they wanted the results here and now. But it's only natural. I think that another problem was, on my end, is since we are a community-based organization, a health provider in the community, we felt a bit frustration because all the media was all the time only in hospitals, where you can video patients at their beds in the ICU, and the staff members with like astronaut suits. So of course, for the video, it's much stronger than to film someone calling a patient at his home. 98% of the positive cases were treated by the health providers like us, because the patient stayed at home and we had close contact with him to see that he is okay. But this is much less sexier than, of course, filming in hospitals.
And during the COVID immunization, what was your biggest challenge?
First of all, we had a flood of media from Israel and from all around the world. And mainly, we got a lot of compliments. The biggest challenge that I had is, since Maccabi decided to follow the policy and not to vaccinate anyone else outside the age groups that the ministry said, there was a lot of criticism against Maccabi, saying that we are too stubborn and that we are not flexible. But I must say that it was a very, very hard challenge media-wise. But I must say that the people in Israel, now we got the results of in Israel, you can change your HMO 6 times a year. And we just got the results of the last period, which is from 16th of November to 15th of January. And the vaccination started at 21 of December, exactly in the middle. And we saw that many Israelis turned to Maccabi and only few left. So we think that our policy, even if it was very hard to keep, the public really think that it was something good, and he felt that he can trust us.
Mm-hmm. Apart from the questionnaire from the nurse, was there any requirements for the lab testing, antibody testing prior to vaccination, or nothing like that was required?
In Israel, you don't need to have any kind of test before getting vaccinated. Of course, if you are under isolation because you were exposed to a patient or you are positive case, you are not allowed to leave your home and you are not allowed to get vaccinated in this period of time.
What do you do with the doctors who publicly, or with professors, academicians who publicly speak against vaccination in Israel, or it is not a problem?
I must say that I don't feel that it is a problem. Not many of them are doing that. There was one in the beginning of the event that said that COVID is just like a flu with great PR. And I think that it's so much off the mainstream, I wouldn't pay too much attention to that. It's not a major
it's not an
problem.
issue in Israel, right?
Not too much.
Okay. Tell me about people who are involved in vaccination itself, because as I understand, those are nurses from, as you said in the first interview, which we did several days ago. How are they inspired, motivated, tired, desperate? What is their mood and what is driving them forward?
I think that in the first few weeks of the vaccination, they felt like they are the commando soldiers who are protecting the fort. And so the motivation was really amazing. And most of it is still very much preserved. Yesterday, Israel is not very familiar with snow. So yesterday in a city in the north, there was snow. And one of our workers, of course, if there is snow, there are no buses or any public transportation because we are not used to it. And one of our workers just filmed himself going by foot to work and saying, well, I'm a Corona fighter. I have to come to my shift. And he became a hero in the Israeli media just by walking in the snow and saying that he must reach his place on time. So the level of motivation is very, very, very high. And each person know that each day we have like statistics, how many vaccinations were given, level of satisfaction, everything, and we want to be at the top all the time. So it drives people crazy, actually.
Were there any complaints? And if yes, then with what those were connected? Complaints from the recipients, I mean.
Yes, of course. Yes, there were complaints, mainly because we were too stubborn and we only vaccinated people who had scheduled their appointment in advance. And usually we did not allow anyone else to get vaccinated. Even if you were in the age group, in some of the places we didn't vaccinate for a few weeks, just if you had scheduled appointment. So this was one problem. Second problem is each time when the ministry opened a new age group, the lines of scheduling appointments and the app, the digital app, collapsed because of too much demand. So for a few hours, people felt that they cannot reach us and they cannot schedule the appointment. I must say that we have the largest capability, the largest telephone capability in Israel, with the largest call center in Israel, but still, each time you open an age group, we collapse.
Were there complaints from the workers who are vaccinating? And if yes, then what was those about?
I must say that I didn't hear one. It's carefully managed. And if someone has some kind of a private issue, he can ask to switch shifts or something else. I didn't hear of problems at all.
Were there any specific groups of supervisors or supportive supervisors who would go around to see if everything is done correctly on the vaccination sites?
Yes. First of all, in each vaccination site, there is a senior nurse that takes care of everything. And if someone needs some kind of consultation, she is the chief officer there. And plus, we have some kind of a team going from site to site to see that everything is okay. That the refrigerators are kept running good, that all the hygiene manners are carefully managed, and there is a special report that he conducts. So yes, everything is managed as in the best way that we can, at least.
Did you have to develop any specific logo or some visibility to this campaign or any motto or anything, or it just didn't need it because the demand was so high?
Well, there were some minor logos that I got vaccination as well, etc., etc. But since we are not aiming at kids, so we didn't need to find too much creative ideas. I can show it in one of the slides. If I can share my presentation for a moment.
I guess you can. The operators will do it now, I think.
Okay. Here it is. Just a second. It's not the one. Here it is. You can see that here it says, I got vaccinated against Corona for the population health, or I got vaccinated to keep my family. I got vaccinated to support the small businesses and small shops, etc. Here it says, it's like a sticker that you get after you get vaccinated, saying yes to the vaccination, things like that. And in our website, we wanted to provide a lot of information so you can see the normal, like a very routine logos, not more than that.
Mm-hmm. I see. Can you just a second? Let me ask the operators to bring you back to the screen. Yes, now I can see you back in the screen. Which human stories did you use, so to say? I mean, if you can say, of course, the word use with the human stories. like somebody dying of COVID, as I understood. What else was used for COVID itself and for immunization? What type of human stories?
In a situation like that, you have to again mix the success stories of, wow, I got vaccinated, it was so fast, how amazing is Israel because the prime minister got us the vaccinations. We are not a political organization, of course. So on one hand is the success stories, and on the other hand is the very sad stories about people who got sick and died, or people who are suffering from long COVID symptoms, which we see very often now. So at the first weeks, all we saw is very old patients that are dying. And from the youngsters, it doesn't really speak to them because he's an old person. But now we are starting for a few weeks, we're starting to see very young patients who are dying. As I said yesterday in the news, the hot story was about someone at the age of 35, I think, with a baby, I don't remember if 2 weeks or 2 months, but like the saddest story that you can think about. So I'm sure it really encourages people to get vaccinated.
Do other countries come to you for consultations for how to do it so quickly for such a big amount of people? Or it's only foreign media or other ministries and other, I don't know, people who are inside of in this operation? Are they coming to ask your advice for that?
Yes, many countries are coming. Not coming actually because the borders are closed, but we are doing a lot of Zoom meetings with many other countries, also done by the governments, like the Ministry of Foreign Affairs from our side, together with an expert from the health provider. And also, like I got approached by my LinkedIn from someone in Japan who wanted, from the Japanese government, who wanted to ask few questions, and also from the NHS in England. So we are all the time connected with many countries, of course.
Why Pfizer? Why not other vaccines? And do you think that you will have other vaccines on the ground for the coverage?
I think that this is what we started with, and this is what we had the largest supplies. For instance, AstraZeneca did not arrive to Israel yet. And Moderna, we have, if I remember correctly, 100,000 units, and that's it. And since it's such a small amount, we do not want to put it inside our compounds, and there will be a mix, and maybe someone will get confused. It's too little amount, and we are not suffering from shortage of supply of Pfizer. So maybe the 100.
Were you very convincing to the manufacturer to get it in such a huge amount and one of the first in the world?
Probably the government did whatever it needed to do in order to get such. Everyone says that maybe the incentive for Pfizer, instead of just money or together with money, was a lot of data that Pfizer can receive on this vaccination. So be it. Well, at least we are vaccinated.
What about pregnant women? Is it a contraindication in Israel? Or if the woman was vaccinated, is there any issue, problem, fears related to that?
It was in the first, but then we had few very severe cases and also death of pregnant women. And many of them came to get vaccinated, not in the first trimester, but after the first trimester. Many of them came to get vaccinated. I can even search the data.
If you can have a look.
More than 2/3.
Because this is one of the frequently asked questions in Ukraine. So if you have any data on that, that would be very nice.
I can just check. It will take me a second.
I know this question was asked by Lyudmila Kovalskaya. So this is the response to her.
Second, I'm trying to check in the it is okay, so pregnant women, oh, actually lower than I remembered. We vaccinated already 45% of pregnant women.
45%?
Yes.
And how many people you think it is?
Well, in Israel, there are now probably around 120,000 people, women in pregnant. But the saying is that if you are planning pregnancy in the next few months, don't get vaccinated yet. I don't know if they're still keeping this order. So you don't need to take just this number, but also to add at least one third to this 120 and say it's like 160,000.
And 45% of those are already vaccinated despite of being pregnant or getting prepared to pregnancy, correct?
Yes. But I'm sure that we will achieve more once there will be more stories about pregnant women who got very bad COVID.
I asked you this question partially in the first series of our interview, but we'll ask it again from a bit different side. Obviously, this is a huge investment from the government, financially speaking, I mean, for the vaccination. So what is the investment from, for example, Maccabi, or it's from the Ministry of Finance, a separate line to finance the health workforce participating in the immunization?
First of all, we are a non-profit. We budgeted by the government for the routine services that we provide. This event was not budgeted from the routine, and we are building on getting, of course, separate money from the government. At least the government is supplying us, of course, the vaccinations itself, but also the syringes and some of the equipment that we need. Still, we are hiring a lot of staff, and we are building or hiring new compounds. So it is a lot of money, hundreds of millions of shekels.
Which you got as a separate line for this operation, or is just the money which you had before?
No, like any government, you come to the government. There is a saying in Israel, a joke. Son comes to his father asking for 5 grivnas. The father say, why do you need 4 grivnas? Take 3, puts out from his pocket 2 and gives him just 1. So I'm sure that if we come to the government with, let's say, 100 million shekels, we will get out of it probably half.
There is a question from Ina Ustimenko asking if you have the one list of those who are vaccinated. But as far as I understand, you are totally digitalized, so the information of each patient gets to the system, correct?
Yes, we have the information who got vaccinated, yes.
And how many people who, for example, are migrants, do not have documents, are not in the system, are they refused or are they being vaccinated? And how many people like that were vaccinated? Idon?
Now I can hear you again.
Okay, yeah. So just once again, we'll ask you, those people who don't have documents, who are, for example, migrants and are not inside of the health system, how many of them did you vaccinate through this operation, through this campaign?
The national health insurance law is covering 100% of the Israeli citizens. But of course, if they are, let's say, diplomats or foreign media or foreign workers, we can vaccinate them based on their passport number. And we keep the documentation, and then we supply them with the diploma or the certificate that they were vaccinated.
Do you have big safety concerns with this vaccine? Is it safe vaccine? Do you have lots of reactions? Not a lot of reactions, complaints?
No, okay. There are a lot of, most of the people are suffering from very local problems, like my shoulder was hurt for 2 days after the first and after the second vaccination. We have a graph on that, of course, I don't remember the details, but we see much less than we anticipated. We do see that after the second vaccination, young people are suffering from flu-like symptoms. Young are suffering much more than old.
What is the percentage of death from COVID? What are the figures with death from COVID in different age groups? And for example, in the group above 80?
Okay, so at least in Israel, we have about 5,000 people who died from COVID, which is 0.5%, I think. Most of them are old people. And we still see most of the severe cases in hospitals were, until 2-3 weeks ago, were very old people. But now we're starting to see a shift.
Why? What do you think, or what doctors are saying?
There are probably few factors that are combined together. First of all, the old people were the first ones to get vaccinated. And we can say for sure, yesterday I issued a press release. We measured around, first of all, I'll answer your questions and then I'll give the data. Mostly old patients are now not getting positive because they got vaccinated already 2 months ago with the first shot and a month ago with the second shot. So they are covered. Second, maybe the British variant is a bit more harmful and violent to young ages. We still cannot say it definitely, but we do see a rise of numbers in the young population. Now, yesterday I issued a press release. We checked around roughly 600,000 people who got vaccinated at least a week after the second dose. And we had a control group of 600,000 people who didn't get vaccinated with the same demographics. And you can see clearly that out of the 600,000 who got vaccinated, we had, if I remember correctly, 1 out of 1,000, one positive case out of 1,000 people who got vaccinated, which is very good. And also those who got positive are with very mild symptoms. Only about 15 out of them needed to be hospitalized, and only 4 of them had severe symptoms. So we can say clearly that the vaccination protects from getting positive, and once, very rarely, if you get positive, you suffer from much milder symptoms. Now, in comparison with the control group, the numbers are much higher. It's like 1 to 30, not like 1 to 1,000 versus 1 to 30, which is very high.
Do you have special person devoted to collecting mythology on this immunization or on COVID from Israeli media, international media, social networks, and especially the channels which are ex-Soviet Union, people coming from ex-Soviet Union watching?
Well, there is a problem, especially with this group of ex-Soviet Union. The ministry put up a team, the Ministry of Health, to fight the fake news. So they are monitoring all the media channels and all the social networks and try to fight back. What we see is that in our population, half of the 1 million immigrants that came from former Soviet Union to Israel in the early 90s, half of them are members of Maccabi, of my organization. And we certainly see that the older people that came from former Soviet Union, which are now very old, they are less likely to get vaccinated. They think that everything is a conspiracy and they cannot put any trust with the FDA. So, but it's a problem that we are confronting, and I'm sure that at the end, even if it will take a bit longer, at the end, the ratio of people who got vaccinated will be very similar.
Is there a raise of calls to the family doctors from the patients to get their opinion, like the opinion of your doctor, whether to do it or not, or it wasn't an issue?
I can't say that it was an issue, at least not until now, because people wanted to get vaccinated. But now we are starting to ask the doctors to tell their patients that they must get vaccinated. So once I come to my doctor with, I don't know, I have a knee problem, he will get a pop-up on his screen saying, look, this guy didn't get vaccinated for the COVID, send him, tell him that it's very important, etc. So each time that the patient meets someone from Maccabi, he will get the same message.
What would be your advice to us? Because we haven't started yet. We are starting soon. So what's your advice? You know Ukraine because you were here several times talking to the doctors. We already have an issue which, for example, Anna Galchenko was writing to us that doctors do not want to get vaccinated with this vaccine since this is the AstraZeneca produced in India, for example, or some other mythology about some other things. So what's your advice to us how to proceed to be successful?
For sure, you have to convince the doctors. That's a major obstacle. If you will not do that, it's a major obstacle. You have to convince the doctors, you have to recruit them, because they will be the best ambassadors or the best messengers to the general public. So it's a must. Now, one thing very good about health stuff or the health systems in the world, there aren't any secrets, meaning there isn't any problem to cooperate between different countries. So I can just suggest that I will ask doctors from my organizations who were born in Ukraine, and we can maybe try to coordinate another Zoom meeting with a doctor, an Israeli doctor who came from Ukraine to speak about it. And they will see a doctor like them and talking positively about the vaccination. Maybe it will give us some points.
Anything else?
Logistically, it's very important to provide a patient with a wow Like he comes, he gets inside, no waiting lines, everything is very much arranged. He will feel that the general atmosphere will be very positive, and it's very important.
Mm-hmm.
Now,
More.
I know that the banks in Ukraine are very much digitalized. So I don't know how to do it, but maybe if the health system is not yet digitalized, maybe to try and make some kind of cooperation between the health system and organizations that can provide the digital infrastructure in order to make the appointments, the documentation of the vaccination, etc.
Okay. More.
Next time, tell me that I need to get ready for such questions.
Okay, then I will prepare the questions up front for the next time on that. One more thing to discuss. We have an issue with using lots of drugs which are not needed and not recommended and non-evidence-based for the COVID itself. And it brings lots of difficulties because you have to, for example, I as a doctor have to consult after some other doctors. I totally disagree with them. I don't know how to elegantly position it in front of the patient and all things like this. And patients are spending money on the very expensive drugs, which are not evidence-based, for example. Do you have this issue in Israel? How you fight with that? Or everybody is in agreement and not using anything which is not recommended for COVID?
I'm sure that few percent of the population believe more in natural things, and they're trying to find ways to strengthen their immunity system. At the beginning, they were talking about lemon juice that may help the immunization system and to protect from COVID. I think that there isn't an issue of doctors saying use that drug and another doctor saying use that drug regarding COVID. I don't think that that's an issue. Since we are with 4 health funds, the policy by each health fund is very clear to the doctors. And if they have a question, they know who to turn to.
Is there an overall issue with the burnout of the doctors working in COVID, or they are okay and they feel spirit to fight more?
There are few processes going parallel. First of all, less patients are coming to the clinics. So many of the engagement is done remotely, either by phone or by email. And some of the doctors like it, but some of the doctors, they became doctors because they wanted to meet people, and it is a problem. Second, the COVID itself, at the first stages, we did a center of doctors and nurses to give services to all the patients that are hospitalized at home. Then the pressure was too high, and we decided to localize it, and each family physician was told who are his patients that are now sick, and he was instructed what kind of services to provide them. So the pressure on the GPs was a bit higher. I think that they are doing well because these 2 parallel procedures or processes are paying each other or are in a balance each other. So I think it's okay.
Okay, let me check if we have any more questions. Oh, we just have very pleasant words thanking you for the information from this interview.
Thank you. With a pleasure.
Just a second, I am checking. Okay. No, I guess that everything is fine. We don't have any more questions on top of that. Thank you very much, Ido. I hope that we will really organize something with Israeli doctors and nurses who are from Ukraine originally. I think it's a great idea to share the experience on COVID itself and on the COVID vaccination. I hope you enjoy the snow.
I will. I hope it will fall here next to my house.
Yeah, we have as well snow and frost. So thank you very much once again. I will be getting prepared for our next interview and hope that you will tell us about more success even than you have now. And for us, it's extremely important and interesting because we haven't started yet, and I hope we will start soon with the vaccination. And we have a rise of case of COVID patients, especially in the Western Ukraine. Hospitals are packed. And of course, our colleagues are very tired because they have too much work to do at all the levels of primary and specialized healthcare. So stay healthy, enjoy the snow. Thank you very much once again.
Bye-bye.
Ciao, ciao. Bye-bye. Lehitraut.
Lehitraut.